Welcome to the Modern Wellness Podcast. I'm your host, Dr. Mary Pardee. This podcast, along with my private practice in LA and my newsletter, all are aimed to providing you evidence-based information around preventative medicine, longevity, and health in general. Join me in dispelling health myths as well as cutting through the noise that is social media. I hope that whether you want to optimize your performance or just in general get healthier, the Modern Wellness Podcast will help you do that. Today, I'm joined by Sebastian Zorn, who's the head Team Performance Dietitian for the Los Angeles Rams. He spearheads implementing cutting-edge nutrition strategies to optimize player performance. He helps elite athletes achieve peak performance both on and off the field. And beyond his role at the Rams, he's really passionate about empowering fellow dietitians through the Summit Nutrition Network, a platform that he founded to foster collaborations in the sports nutrition field. Previously, Sebastian's worked at Stanford University, University of Illinois, Chicago Bears, and the Ohio State. Now, Sebastian is also the husband of Emily, the dietitian that I had on a few weeks ago, where we dispelled nutrition myths and did some really fun rapid fire rounds. So if you haven't listened to that episode, go back, take a listen. I think you'll really enjoy it. I think today is going to be great. I'm so excited. I have a huge passion for the performance world. And so I'm interested to dig in to see what is actually going to give people this edge in performance, whether you're an elite athlete or just somebody who really likes to optimize. I hope you enjoy it. And if you do, please leave a review on Apple Podcasts. You're my first guest who's a repeat guest, which I think means something. It's exciting.
That is exciting. That's a big deal.
I'm really excited to have you on because when we were talking, we touched upon ergogenic performance enhancing aids that athletes may or may not use. And I was like, okay, this needs to be a separate podcast because I want to dive deeper into each of these and talk about them and pick through them. And so that's what we're going to do today.
Awesome. I'm fired up. It's a topic that's near and dear for sure.
Great. So let's just start off by talking about what is an ergogenic aid.
Yeah, so there's a lot of different categories. So ergogenic aid is basically anything that helps with athletic performance. So this, or really performance in general, so that could be cognitive as well, kind of in that factor, but we're talking about things that are mechanical. So if it's like a kind of elbow sleeve for a bench press, for example, would be a ergogenic aid. The categories that, and pharmaceuticals fall under this, nutrition falls under this, and really nutrition is kind of where my expertise lies as far as ergogenic aid goes.
Yeah, so that's the category we're going to go into in terms of nutrition, nutraceutical, ergogenic aids that don't require prescriptions. We'll probably do another episode on that, like prescription ergogenic aids in a separate time. And,
that's a huge topic right there.
Yeah, and you are in professional football, and so I want to talk a little bit about what that means in terms of regulations and things like that, but we'll talk about that closer to the end. I want to first highlight that I organized this in a way where we're going to go through some of the top ones that have the most research behind them, and one of the most studied, most well-known ergogenic aids is also the most used drug in the world. It's over the counter, but it's caffeine.
Yeah, caffeine and creatine are the two kind of, creatine in the athletic world, but caffeine in the world is, it's the most widely used ergogenic aid there is for a lot of different reasons. Really great podcast is the, what is it called? Ancient Herbs, I think. Okay. It kind of goes like a 2-hour podcast that goes into the history of caffeine and kind of how it came to be the way that it is now. And I'm fully caffeinated. I'm aided up, ready to go. So
huge fan of caffeine. Sometimes my partner is not a huge fan when I'm on caffeine, but it just really depends on the day. Let's first talk about the mechanism. Like, why does caffeine even work? What happens in terms of athletic performance?
Yeah, so it works in a couple different ways. The ways that I kind of describe it to my athletes the best is that it's a stimulant, which we know and love, and then it also kind of helps push through and it kind of raises that pain threshold as well. So you're able to kind of push further than you normally would. And it is a central nervous system stimulant, in addition to kind of blocking those adenosine receptors and allowing that, basically blocking that tiredness to creep in quite a bit. But we'll go through the dosages and all that, I'm sure. But it is widely very widely used casually. And then for research purposes, if you ever have a supplement or an herbal or anything really that you want to, or that a company wants to demonstrate efficacy with in a performance setting, typically they'll go, here's supplementing with nothing, here's supplementing with a product and some caffeine, because it's so consistently a performance enhancer that a lot of companies will use it to try to sneak it into these studies to show a performance benefit for whatever else they're using. Exogenous ketones is one that came to mind in that sense, but yeah, that's an aside.
I totally agree. And it's a great point that you make, because my patients all the time will send me something, be like, okay, this is a pre-workout. What do you think? Do you think it's going to be helpful? And you scan down the list and it's like, or it's, it's something Vitacost or whatever, and it's supposed to enhance performance. And then you look through it and it's all junk. And then there's how many milligrams of caffeine in it. You might as well just take a caffeine supplement versus this kitchen sink thing where 99% of what's in it is not going to be helpful, and all of the effects that you're feeling are from the caffeine.
100%. Yeah, I'm sure we'll talk about it, but the proprietary blends and the curse of the proprietary blend that is haunting the supplement industry. I understand why they do it, but essentially they're able to kind of protect the formulation, but then hide all the dosages, and they love to do that.
Yeah, that's a red flag that I tell people. If you see a proprietary blend, it's there just to sell. It's a marketing tactic. And what it is, I'll just kind of summarize it. But when you see proprietary blend on something, it means that they don't have to put the dosages of each individual ingredient. They just say, hey, these are the things we put in there. We're not going to tell you what's in there because we don't want you to be able to copy it. And we want you to have to come back to us if you like it. And like Seb said, that's like a huge red flag. It is 100% a marketing technique, and it does work to sell supplements. But if somebody is in integrity, they would never use a proprietary blend, in my mind.
Oh, absolutely. Yeah, I mean, because if we don't know the dosages, then it's really hard to recommend any kind of supplement. Now, I mean, they have to be in order of kind of largest to smallest as far as the dosages. But yeah, I get a crack up out of how they kind of describe them, like, muscle ignition proprietary blend or anything like that. It's ridiculous.
So caffeine, in terms of mechanism, you went over the adenosine piece. The other piece for people that are listening, because I know we're going to have some non-athletes listening, would be caffeine has been used for weight loss for the appetite suppression effect that it has on people as well.
No doubt. Yeah, and a valuable piece of it. And any increase in fat oxidation, whether like truly contributing to whatever the performance may be, is usually not a bad thing.
Yeah. Okay. And so when people take caffeine, in terms of your athletes, what do we actually see in terms of the effect that it has in performance?
Yeah, it depends on kind of what the activity is, but typically, I mean, faster, I guess, reaction times, again, increased time to exhaustion. They're able to kind of push through that a little bit. And then overall, just kind of better cognitive performance, which in a team sport like football, and really most sports, is going to be beneficial there.
And I read something that it's like anywhere from like 2 to 7% performance increase. Is that what you think that?
Yeah, again, totally depends on what the activity is, but usually I usually say like 1 to 7%, and I mean we talked about it previously before, but and that's pretty high compared to most other supplements. Like that is statistically very significant for almost across the board for any kind of performance.
And you're looking at, especially your athletes are going to be elite athletes, but if you can get a 5% increase in performance, that's really significant. I mean, people work for that over the course of years, right? To do that naturally without anything
Oh
else.
yeah. Oh yeah. I mean, we're thinking of like Olympic track athletes, and they do a lot more for a lot less percentage of a difference there. And we'll talk about sodium bicarb, but that's like an extreme example of doing a whole lot for a very little benefit. But if it's a case where that little benefit can make a difference, then absolutely. So caffeine to me is a no-brainer to recommend. There's definitely things that we want to keep in mind, but almost across the board, I am very pro caffeine.
Okay, what do we want to keep in mind?
Yeah, so certain side effects definitely with higher dosages. So the recommendation for the research is basically is pretty honestly pretty high, and I think a lot higher than people think. It's 3 to 6 milligrams per kilo, which for the average individual that's a heroic amount of caffeine. So for an individual's 200 pounds, I mean we're talking the minimum is close to is around 300 milligrams of caffeine, which even for a sketchy pre-workout amount, like they usually, I mean, really the intense ones kind of drift towards that. Most pre-workouts start at 100 or 150 milligrams per serving. So the baseline for the research to see an effect is really high. And anhydrous caffeine will also absorb a little bit faster as well. Um, we use a caffeinated gum that absorbs basically 3 times as fast because it's pure like anhydrous caffeine, and you feel it pretty quick even with a much smaller dose. But yeah, so 3 to 6 milligrams per kilo is a huge amount. Typically, the most of the upper limit, so to speak, where we start seeing kind of almost guaranteed negative side effects of caffeine is really that 9 milligrams or higher, which I mean, I can't even imagine consuming that much caffeine all in one period of time. But we're talking tunnel vision, sweating, inability to focus, yeah, shaking, and then possibly cardiac events as well if we're getting to that high. Now, there is a genetic component to caffeine. Folks can metabolize caffeine a little slower, a little bit faster. But typically, yeah, we want to definitely avoid. I would put the hard limit at 6 milligrams per kilo. I would not really, unless someone is very tolerant of caffeine and really looking to get fired up that day, I would try to keep it under 6 milligrams, which again is still a ton in one sitting.
Yeah, that's a lot. That's a lot. For I calculated mine what it would be, and it was like around 220 milligrams of caffeine, which for me would be like I don't want to take that much caffeine. I probably have at one point, but it does not sound super fun. How many, like, what percentage of your athletes are probably, doing some sort of caffeine?
Yeah, I'd say roughly half. It's been different every population I've worked with. Every university and every professional team has been a little bit different. Some teams, depending on the culture, are very pro caffeine, almost too pro caffeine. Some are much more kind of caffeine hesitant. I do education basically at every off season and then in season as well. As questions come up, we'll do team education where we'll go through these ergogenic supplements that we're kind of talking about today. Not nearly as in as much detail, but and talk about hey what we recommend, what we don't recommend. And caffeine is one we absolutely provide and recommend.
Yeah. And you said it comes on really quickly with the gum. Like, are you talking like minutes there or?
Yeah, with the gum and with anhydrous caffeine, I mean, anecdotally, research might not necessarily support this. I feel it with, especially with a higher dose, like a 100 milligram dose with anhydrous caffeine, feel it within 5 minutes or so, and it's like a noticeable effect. So for something like that, that's a little quicker. It is convenient, and just to have a different form, if you don't necessarily want to drink something. Um, is nice to have around.
Can you share the brand with us?
Yeah, we use Run Gum.
Okay,
There's a couple
cool.
other ones. There's some sketchier than others, um, and we don't use it. It's more like kind of yeah. We have other brands of more of the beverages and things like that that we'll push, but we do have the gum just in case.
Yeah, yeah, that makes sense. And are you usually suggesting people, because like how much before an event are they going to be dosing something like this?
Yeah, ideally you want to do it anything around like 45 minutes to an hour. 45 minutes is per the research of like, hey, this would be the great time to do it, but it's also timing out when exactly is the event. So 45 minutes is like, hey, your bout of exercise, like if you're running a 100-meter dash, 45 timing it out 45 minutes prior to that specific kind of starting gun, so to speak. So your event might have a warm up component. It might be more of a question mark of like when exactly it's starting or when exactly you're going in, but timing it out so 45 minutes prior for that if you're doing a bolus of caffeine like that. is what we recommend.
Probably don't want to take this much caffeine, but on like the first time you take it to be an event. Would you agree with that?
Absolutely. Yeah, caffeine is definitely something, and then we'll educate the guys on this as well. It's like, hey, this is what we recommend, but obviously, like, talk to us, and we'll do this on the front end during practice, during training, so we can get a sense of it. It might be something that you don't enjoy at all. Beta alanine is another one that has pretty visceral responses, good or bad. So definitely trying out caffeine and really anything nutritionally if we're trying something new, even whether it's a new intra-workout fuel or a new beverage. You do want to try anything out kind of beforehand so that if there is a negative reaction, it's not at a time period where you like absolutely need to perform. Now they always don't listen. Like I've definitely got a story or two. We had a guy who, and we'll talk about nitrate, but he took one of the side effects of dietary nitrate, if you're getting it from like a beet supplement, is your urine can turn pink, which if someone doesn't know that they're taking a nitrate supplement, like a doctor would look at that and say, you've, bruised or injured a kidney, you have internal bleeding. And we had this guy strapped up at halftime getting ready to go to the ER, and he told us, hey, oh, by the way, I drank 2 of these, double the dosage, didn't tell anyone, was not a guy that took it regularly. And by that point, it was too late. And luckily, it was a preseason game and he was a bonehead rookie, but it was a pretty funny incident and a great example that I love to use for our guys now. And I mean, talks about the importance of professionally on our end of communicating with our other sports medicine providers, saying, hey, if we see this, just it could be contraindicated if this is what he's consumed prior. So a
Yeah.
lot to
Just like
learn.
beets can also turn your poop like reddish purple too, so you can see that. Um, okay, yeah, that's not a fun one, but glad they figured it out a little bit sooner than later.
Mhm.
Um, and there's a few myths surrounding caffeine, probably one of the most common ones being, coffee dehydrates you. What do you tell people when they say that?
Yeah, if someone is a very infrequent coffee caffeine drinker, then absolutely it has a diuretic effect and a relatively strong one at that. But if they are a regular caffeine drinker, that diuretic effect is really significantly reduced to the point where it's not a factor at all. But
Yeah.
for that person that is trying it for the very first time, that is something that we cue them on.
Okay. I actually didn't know that piece. I always consider coffee as still hydrating when you like count how much water it contains,
No doubt, and it is net hydrating still.
but still has a diuretic effect, which I know you mean. Okay, that makes sense. And what about the kind of comment that caffeine harms your heart? You touched upon it a little bit.
Yeah, I think it harms. I mean, overall, classified definitely would be myth. I would say anything, if you are someone who is at risk and that having a increased heart rate would be risky for you, given any kind of background in any comorbidities or anything like that, then there is a risk associated with it. But outside kind of the central nervous system stimulation, and if there are any other heart conditions, there is no sort of negative effect
Yeah.
outside of the side effects of really high dosages that we talked about.
Right. Normal dosages, especially what most people are going to be doing, like 2 cups of coffee a day, not even up to the 6 milligrams per kilo.
Yeah, I would hope that casually that would be a lot. Yeah.
Yeah, that would be a little much. All right. Any other applications in the NFL that you see around caffeine that people might find interesting?
Um, Huge coffee drinkers. Depending on the culture, quite a bit of energy drinkers as well. Um, Not as much. The 5 hour energies have kind of come and gone, so I haven't seen too much of those. But like the Red Bulls, the Celsiuses, I see all the time. And probably the biggest culprits of caffeine intake are not even the players, but really the coaches and the staff. They're
Hmm.
working. I mean, we're all working 7 days a week, long hours, early mornings. But yeah, caffeine is the lifeblood of most college and professional football organizations.
Yeah. Any difference between college and professional?
The biggest difference is that it is technically a banned substance at the collegiate level. So the level of blood, the millimolar in the blood for college for you to test positive is extremely high. It would be close to that 9 milligrams in a single dose, and then you'd have to basically be tested an hour later. I've only heard of one instance in the country of someone getting popped for caffeine in a collegiate setting. But it was an individual on a women's hockey team who was not a big individual who had chocolate, 2 scoops of pre-workout, coffee, and just basically dosed these multiple different sources of caffeine, green tea as well, and was not at a big large body weight, and then ended up testing positive after her championship. But very rare do I see that, to the point where, again, I recommend it almost across the board, even in the college setting. And the only difference there as well is because it is a banned substance, there is some gray area of providing it or not. And so college students have coffee at their dorm rooms and things like that, and it's easily accessible for sure. But some departments decide whether or not they want to provide it directly or not at all. It kind of depends on their compliance departments.
So are you saying that at the college level, is it football? Is it all sports pretty much, or?
Yeah, there's only one basically umbrella, the NCAA
Yeah.
for banned substances. Yeah, it's interesting. Alcohol is a banned substance for pistol and rifle, and beta blockers for like reducing heart rate and creating a more accurate shot. But outside of those examples, it's one banned substance list across the board for the NCAA.
Okay. And so when something's on the banned substance list, it's the same as like USADA and WADA, where you're not supposed to consume it. So they're expecting that no college athletes are consuming caffeine.
The lists are slightly different, but that's where I think they set the bar at such a high level, so that they really don't ever have to get there. I think at the end of the day, they're trying to protect the student athletes. So they're like, hey, maybe don't go above the equivalent of a 9 milligram per kilo dose in once, because college students absolutely will push the boundary. Oh, what's good to take? 3 to 6. All right, I'll do,
Right.
9 to 12. Sounds good. Yeah, no matter how much we try to educate them, that definitely happens. But
Okay, so it's
yeah, I
not
think
that it's not that caffeine is completely banned. It's that it's banned at high levels, or is it banned?
correct.
Okay.
Correct. And I mean, truth to be told, like that is the case for a lot of those banned substances, because it has to be basically detectable levels,
Right.
and they set the thresholds at kind of reasonable areas. So, I mean, another example, we're kind of getting off topic here, but another example would be like testosterone. So there's a kind of normal range for testosterone in an individual. If they are significantly above that, if they're double that range, then absolutely flag. But if they are on the higher end of that range, might not necessarily flag. So, and there's certain compounds as well where it's, hey, we can detect very small amounts. And there's other compounds where unless it gets above a certain threshold, it won't flag.
Right. Yeah, that makes a lot of sense. Okay, number two, I want to cover. Well, first, we can't talk about caffeine without talking about gastrointestinal side effects, because it's one of the. First of all, I treat a ton of people with IBS constipation, so sometimes we use it to help people go to the bathroom. But if you're an athlete, you're planning a race or an event, and you're using caffeine, this can sometimes be, something that can really change things. Do you talk to your guys about that at all?
Yeah, absolutely. For our post-surgical guys, we use it in the same way. In addition, for the other kind of normal kind of constipation remedies, we do mention, hey, black coffee might be a way to get things moving, in addition to the other things that we use. But absolutely, and that's kind of, I think you mentioned it earlier, but the benefits and the absolute need to trial these things
Yeah.
leading up to, and especially in the doses that you're anticipating to take, I think that's so important. And then as much as possible, a factor that some people don't necessarily factor into those race day or game day or event day component is just the adrenaline that is kind of coursing through your veins, in addition to everything else that can really throw a wrench and change these variables a little bit. So in any way possible, and it's hard to replicate like a marathon day energy and excitement outside of that specific day. But as much as we can try to replicate that beforehand, it's going to help make it that much easier when the day arrives.
Yeah, yeah. And for those of you who don't fully know what we're talking about, like you want to know how long after you drink caffeine you need to go to the bathroom so that you are
100%.
not on the start line when that happens.
Oh God, yeah. Or halfway through, God forbid.
Oh, yeah. All right, next up is creatine. Creatine's getting a ton of headlines right now. Like people are jumping on the creatine wagon. It kind of comes in waves. I feel like this happens every few years when things get more publicity, and creatine is right now in that spotlight again, and for good reason. I mean, it's got great research behind it. Can you go through a little bit about like why creatine actually works in our body?
Yeah, I would say the foremost kind of mechanical, or excuse me, the foremost mechanism as to why creatine is beneficial from an ergogenic effect is it increases the phosphocreatine in the muscle tissue. And so you're able to basically replenish that phosphocreatine energy system so 3 to 5 second burst of energy at the start of competition where you are fully rested. You are in lifting for the most part. If there's a couple minutes in between, you definitely tap into this as well. But you're able to replenish that a little bit faster. There's mechanical benefit to having a little bit of more water that is the more phosphocreatine that is in the muscle cell that pulls in a small amount of water as well. So there is some mechanical benefit to a kind of slightly larger muscle cell. So there's a little bit more elastic resistance depending on the exercise with a slightly larger muscle cell. So for strictly kind of short bouts, lifting and explosive activities, that is sort of the mechanism that is most well known is that phosphocreatine increase in the muscle tissue. There are some benefits, and there's more and more research coming out with the cognitive benefits of creatine. Originally, this was discovered when measuring the creatine levels in the brain and seeing that the creatine levels in the brain were significantly reduced after a TBI or concussion. So the thought was, hey, if we dose or even megadose creatine, that we are providing more energy to the brain when it is in a state of higher energy need. And it is such a can't hurt, might help supplement to where you can get up to relatively high dosages, like 20 grams a day. And those dosages are the same dosages that are kind of being shown that's you really see a higher level of brain creatine at those higher dosages and potentially cognitive effects. I don't think there's enough research at this point to like broad scale saying, hey, everybody should be taking mega doses of creatine. There's a study the other day that showed some beneficial effects of like upwards of like 30 grams of creatine, which I did it in a bolus and, had GI distress almost immediately. So, yeah, I haven't seen enough to really recommend broad across the board for kind of prophylactic cognitive benefit above and beyond kind of the simple creatine loading recommendations
Yeah,
that we
the
go
brain
across the board, which
levels.
is the 3 to 5.
Yeah, the brain levels of creatine that you're talking about, those are the animal studies that were done, or was there another study?
This was the 30 milligram. I'm trying to remember what the exact, I'm pretty sure it was a per kilo dosage. I think it was 0.25 grams per kilo. Might be smaller than that. But that was a human trial.
Okay. I wonder how they measured it. They were doing, I'll have to
Yeah,
look
I'm
in.
curious as well. There's certain the cognitive component of it is to me a little bit more nebulous. I think there's um, as far as like return to they measured specifically with the concussion. There's a decent amount of concussion specific research with increased creatine levels, but as far as like prophylactic like cognitive tests, I haven't seen enough to really stand by that recommendation.
Yeah. And what I recommend for my patients is just 5 grams a day. I don't do a loading dose. I don't do anything. I just do 5 grams. Do you recommend something similar? Do you do the loading doses or higher doses for anybody?
Depends on the situation. So, and it also depends on the athlete, so for the most part, almost across the board, we're trying to get to 5 grams per day on average. For our football guys, we lean towards a little bit higher. We will supplement directly in their post-workout shake, kind of taking advantage of that insulin spike post-workout with that bolus. We will supplement 10 grams a day, almost with the assumption that we are only directly supplementing them probably 4 days a week, and they may or may not be forgetting to drink one of those shakes at the time. So we're playing for the human factor a little bit. But anything 5 to 10 for the most part daily would not be a bad thing by any stretch. At the worst comes to worst, you are saturating your muscle tissue.
You're just wasting it. Yeah.
And you're wasting it. Yeah. But 5 grams a day is, and we don't necessarily, unless there's a guy that came in last minute, he's not playing a position where there's a whole lot of like rotational stress on a joint. He's not an at-risk guy. Like the example that comes to mind where we would not load them, but they're coming in late would be like a running back or a wide receiver or a cornerback who 1 to 2 pounds of body weight or 1 to 3 pounds of body weight put on in the course of 2 weeks might theoretically put a little bit more stress than, God forbid, if they did a twist at 3 pounds heavier, maybe they ate a little bit heavier as well. And they're like, man, it's because I'm heavier because of creatine. That's the one thing we want to avoid. So if we are going to have a, 1 to 2 kilo, depending on the guy, weight increase, especially for a position like that, just a CYA, I'm like, we'll just load it slowly. We're not loaded at all, not mega dose it, but just go over the course of a month and increase it like that. But for other positions that theoretically wouldn't be as high risk, we'll load it if they are not currently on it. But almost across the board, we supplement it like that. There's the only situation where I wouldn't would be if it's a guy who is 340 pounds and will get fined if he is above 340 pounds, and the powers that be are not being reasonable and they're saying absolutely we need him at 339, and that's a huge difference. Then we will not add creatine to make him 344, 343 in the short term.
And for the people that are listening to this that are you're terrified of gaining weight, what are you talking about when you're talking about weight gain with creatine?
Yeah, so we're talking about when you're going from not supplementing creatine at all to you are fully loaded with the kind of maximum threshold of phosphocreatine in the muscle tissue. There is a little bit of water that gets pulled into the muscle tissue, which for an individual who is 200 pounds, we're probably looking at, I would say, 1% body weight gain. So it's something to keep in mind. It is not something at all that I think outweighs the benefits of creatine. I mean, very solidly across the board for strength training, we are seeing 3 to 5%, very consistent for strength and power, and just the energy benefits alone. To where if there is, a slight weight gain, especially over the course of a slight weight gain over the course of like a month, if we're loading it or dosing it, the pros definitely outweigh the cons for sure.
Yeah. And so you're talking about water weight gain. We're not talking about putting on fat mass with creatine. That's not how it works.
Yeah.
And potentially putting on some muscle with creatine. Would you agree with that?
Yeah, absolutely. And the way that we measure fat-free mass and fat mass, depending on the system you're using, it will be classified as muscle mass. So even if you're loading it, you want to add 3 pounds of muscle and you're 200 pounds, like over the course of a week, then goes on creatine, it will show up strictly as muscle mass because it's water getting pulled into the muscle cell itself. So it definitely is not fat mass, but it absolutely is something to flag. And as you do already, kind of talking to the patients or the clients about.
Yeah. And do you see where people will gain weight when they first start it and then they'll lose some of that water weight the longer that they've been on it, or do you see them maintain most of it?
Yeah, it's hard to differentiate for me the true, like taking the effects of the activity or the goals of the individual out of the equation. Like there's definitely, if we are loading it, it's pretty easy to see in a 2-week span, like a weight increase. If they are not sort of loading it with a 20-gram bolus for 7 days or doing half for 2 weeks, It's a lot harder to track because we're talking about, small, very small weight gain over the course of a month. And they're usually lifting or doing weight training in kind of combination with that. So it's pretty hard for me to tease out, okay, this increase in lean mass is due to creatine saturation or due to your increased ability to do resistance training. And then you're able to kind of do maybe 105% of what you normally would. So you're getting the benefits of doing 105% of what you normally would. So you get increased recovery and then increased results at the end of the day.
Yeah, and you're saying 105% in terms of increase in volume of what you're doing for resistance training, so therefore getting a bigger outcome. Yeah.
Exactly. Yeah. So it's pretty tough to tease out whether, I mean, theoretically, yes, they have maintained that weight increase, but absolutely, because you're able to do more, and because you're able to do more energetically, you could be burning more calories, you could be gaining more muscle, or just going to burn more calories. You could be all those things. Yeah, it's pretty
All the
tough to
things.
tease out after those first week or two.
Yeah, that makes sense. And you mentioned it in passing, but I'm just going to restate it. I think that you said that there can be up to 3 to 5% increases in muscle strength and power. Is that what was the quote? Yeah.
Yeah, and really how it shows up, it's funny. So there's, I mean, active ergogenic aids and then these sort of indirect ergogenic aids. And the indirect ones are the ones that are more recovery focused versus like actively increasing the effect. And creatine is sort of both because it actively increases your turnaround time between bouts. So you're able to lift you know, as strong as you were. I mean, not as strong, I don't want to kind of just claim across the board, but you're able to continue lifting at a higher power or higher strength throughout the entire course of the resistance training period of time versus it might not even be noticeable, but you might feel yourself kind of dropping off and not as strong for that third set, for that fourth set of whatever you're doing, to where you go down and weight a little bit versus if you were creatine fully loaded, you might feel great that third set, and where maybe you can go up in weight. And that's where kind of the indirect benefits of creatine, by increasing this capacity for resistance training, you're getting, more of a benefit from it, and then an increase in strength and potentially lean mass as well as a result of it. So it's fantastic. I mean, for football, it's like it was designed for football in a lab
Mhm.
for increasing lean mass, for power, for energy, and then to me, the cognitive, the burgeoning research for the cognitive benefits are only a plus on top.
Yeah, yeah. And if you're a patient of mine, maybe say you're a 55-year-old female and you're like, if college, pro athletes are on this, why does she have me on this? I
Yeah,
put a lot of my patients on creatine. Do you agree with that?
absolutely. Yeah, I'm sorry because it's just the population that I work with, but
Totally.
absolutely for my parents, I recommend it on whether they listen to me or not is up to them. But absolutely for retaining lean mass throughout injury, for preventing lean mass loss. As one ages, I mean, that's one of the number one factors for decline and for not thriving as they get older. So being able to maintain as much lean mass as possible as folks age is only going to be beneficial as they get rolling. So
Yeah, yeah. And while this population might not be even measuring performance and power and strength and things like that, hopefully they're measuring strength at some level. But I still find it to be like if you're going to be taking a supplement, that this makes sense to be on the list for most people, just because muscle decline with aging is one of the leading things that we're fighting against in terms of reducing your risk for osteoporosis. But if you look at the list in general, we're talking about cancer outcomes. I mean, you can go on and on with that. So I think it's a great thing to consider. And speaking of lifting, my mom is now joining me in my gym. So she's now seeing my own personal trainer. So I've got her, and she's on this next supplement that we're going to talk about, and creatine is going to be the next one that I'm going to introduce to her. But before we leave creatine, there's actually a bunch of myths that I think we should go through really quickly. Does creatine damage your kidneys? Is a big one.
Oh, that is a huge one, and it's honestly it's pervasive even with a lot of doctors, a lot of physicians out there. So it does not. I mean, The amount, and I think we talked about this last time, but the amount of like protein, for example, that you'd need to consume to really put a high stress on your kidneys would be something in the realm of like 600 grams per day. So creatine, now to know if we're doing blood work, increased like muscle creatine stores will increase your creatinine levels. That's almost a guaranteed. And unfortunately, there's not a whole lot of intake done depending on when someone is doing their blood work. So the doctor sees increased creatinine. My athletes almost to every single person had increased levels of creatinine because they were also doing significant resistance training. They are breaking down a significant amount of muscle tissue day in and day out. So that is totally fine. Now, if it is an individual that is in a dialysis center, obviously that is a completely different story. But in the populations that I work with, in a healthy population, without any kind of kidney distress or anything like that, there is no risk for kind of creatine supplementation. Fun fact, I found out that I have one kidney this year.
Oh,
Just to go off the
congenital.
side. Yeah, found that out. Yeah, good times. Did a lower back MRI and they were like, "Hey, we think something might be missing here. Uh, let's get an ultrasound." Did it, and they were like, "Yeah, this is where it would be." But normally you don't find that out at 32 years old, but here we are.
No, yeah. Well, you got a good one though, so that's good.
It is an exceptional strong kidneys from what they said.
Yeah. The kidney things, I don't know if you talked to your players about this, it might be helpful, but in my patients who are really well adequately muscled or just like really big guys, I would never just run a CMP, which is going to be your complete metabolic panel. That's what's going to have the creatinine in it. Because, like you said, it doesn't even matter if you're not on creatine. If you're just a really big, muscly person, it's going to be most of your athletes, you're going to have a higher creatinine level because of that muscle mass. And it does not mean that your kidney function is below optimal ranges. So I almost always will run a cystatin C on that population because it's not going to give you that kind of like false negative feedback from the creatinine. And so if I have somebody on creatine too, another reason to run a cystatin C to evaluate for kidney function in those individuals to get rid of that variable.
Absolutely. And that's why, I mean, so important to not just get a blood test and throw it to the wind or try to interpret it yourself, to just get it looked at by someone who's kind of knowledgeable with your specific population and what you're looking for.
Yeah, yeah. And any other things that float around in terms of creatine myths that we should talk about?
Hmm.
I have one. I
I
have one. Oh no, you go.
yeah, I've heard this actually. I mean, even just in the sports nutrition world, I got this question the other day of creatine with youth sports.
Hmm.
And like, and again, it's not a population I work with, so I deferred to the individual who was working with the high school age population. But from what he was saying, there's no reason to be afraid of a youth athlete consuming creatine. Now there's a whole other, and definitely a flow chart of supplementation, ergogenic supplementation in the first place. And we touched on that last time of like, is there even a need? Is there something beneficial? Are there bigger rocks to talk about first? Absolutely. But if all those things are kind of checked out in green light, there is no reason to not supplement creatine monohydrate specifically with an athlete that is on the younger side.
Yeah, I mean, that's a huge one that we need to talk about. The form of creatine, there's a bazillion on the market, and the company, talk about marketing, is always coming up with a new formula so that they can tell you that you should buy theirs because of X, Y, and Z. It's a way to stand yourself out in the market. You just said it, creatine monohydrate's the only one that you should be purchasing. Yeah.
100%. And it's not expensive. It shouldn't be expensive if you're spending more than $25 for a tub of creatine monohydrate or creatine whatever, then you are probably overpaying for it. There's plenty of third-party tested sources of creatine that are fantastic. And if it isn't broke, don't fix it. You don't need to go with creatine malate or whatever the other new forms are.
Some of the things I'm seeing now is they'll pair creatine with X, Y, and Z and say you need these things together to get the effect or like whatever. But most of these things that you see are complete marketing
Yeah.
tactics. They work, which makes me
Oh
so
yeah.
angry.
One that I saw 2 years ago was a form of creatine that doesn't add water weight. And it was like, I was trying to get in the mind of the athlete. I'm like, look, if it works, if it increases the creatine phosphate in your muscle tissue, your muscle tissue will pull in more water, more phosphate, more water. Like if there's no water, then it's not getting in the muscle tissue. Like that is the sign of like, hey, is it working or not in a way. So it was, yeah, it was ridiculous. And our guys are just as susceptible. Like I get questions at every level with, every athlete you can think of, hey, what do you think about this? And that's, you want to invite that. You definitely don't want to shoot them down to saying like, that's the dumbest thing I've ever heard, even if it is, because then they won't bring something to you the next time. But
That's a really good point. That's a very good point. So 3 to 5 grams for most people. You guys are doing much higher doses for some people. You're doing loading doses for some athletes. But like 5 grams a day is going to saturate a normal body weight person for most part. Some of them may need a little
absolutely.
bit higher dosing.
Yeah, for
And
that 3 to 5 for that maintenance. Yeah.
yeah. And then there will be some people that get GI distress, even with 5 grams a day. I've seen it. It's less common, definitely for 20 grams. If you're doing like a big bolus at once, for sure can cause GI distress. Do you suggest anything if people can't tolerate it?
Yeah, you can spread it out throughout the day as much as possible. So spreading it out is a great way to do that. I mean, we'll talk about bicarb a little bit later, but that is absolutely a strategy. Is like chronically loading it. The timing for creatine is not as important. I mentioned kind of post-workout for that's A for convenience and then taking advantage of insulin. But I would say if you pair with a meal, if you have 5 grams or 3 grams, you can kind of spread it out, dose like sort of do a half dose with a meal in the morning, half dose and a meal at night, but truly the time does not matter. I usually try not to dose it right before activity, just in case there's some GI distress caused by a bolus like that.
Yeah. Okay, great. Um, Anything else on creatine before we move on?
Ooh. Creatine and caffeine. Those are the two where they've got the most research out there, literally thousands of research articles for both. Highly recommend ergogenic aids.
Yeah, agreed. Next up is whey protein. So I don't know if we consider this one or it's a food. That's what I
Yeah,
classify it as,
yeah.
but it's a great one, and I think that it's worth talking about today. Let's talk about, well, we're going to go into a few different ways, but why whey protein over like a pea protein? Why would you ever suggest one over the other? Or would you?
Yeah, well, whey protein and a pea protein, like both whey isolates, or both isolates, not a huge difference. It would maybe be more preference, which a lot of factors can affect preference. Digestibility can be is relatively going to be similar, but again, it depends on the individual and how they respond to different proteins. You'd like to think in a perfect world that folks would digest and metabolize. I mean, they metabolize, but digest them equally. Some folks have GI distress with certain protein types. And whey can sometimes, depending on the source, create a GI distress event, depending on the individual. So, but as far as protein quality, if it's an isolate for the most part, pea protein quality is slightly lower. But again, we're talking about anytime we're talking about a kind of a processed isolate, protein isolate, the quality is going to be for the most part incredibly high. Quality being like relative to a egg is kind of the gold standard for protein quality, and typically almost every isolate, I'm sure there's some obscure ones that I'm not thinking about that are lower, but for the most part, every isolate is going to have a protein or an amino acid score above 100. An egg is kind of the gold standard at 100. Whey protein, depending on the isolate, is like 130, 125. So, and the way that they do the scores is basically the amount of the amino acids that are basically that were tagged and then found in muscle tissue at the afterwards. So you're getting your money's worth with just about every single isolate. It's more of a preference and not having any GI distress.
Do you think that the leucine content in whey versus pea, it warrants, like, say you tolerate them both the same, say
Yeah.
like all things equal, do you think that that warrants any discussion?
Absolutely. Yeah, you definitely want to make sure that we're maximizing that leucine threshold. So, but depending on the protein isolate that you're using, you should have an awareness of what that leucine, and depending on what the goals are, you could have an awareness of like proline and glycine or glutamine as well. So finding one that you prefer, but then also finding it in a dosage, you might need to increase the dosage of whatever it is to
Mhm.
get the same benefit of, let's say, a whey isolate, to get the same leucine related benefit in isolation like that. Yeah, absolutely. You want to, I mean, for the most part, maximize your, depending on the goals, maximize that leucine threshold effect.
Yeah, I think I think whey is like 12% leucine content or something like that. Do you have any idea what pea is? I actually don't. I would have to look it up.
Off the top of my head, I don't, and it's honestly it's going to change depending on the processing and all that as well. So, but for the most part, you're shooting for the average individual shooting for 2.5 to 3.5 grams of leucine, kind of per fuel feeding bolus bout, I guess.
Yeah, and why do we actually care about leucine?
That's the million-dollar question right there. Leucine triggers mTOR, mammalian target or rapamycin. So we want to max if our goals are to maintain lean mass, increase lean mass, and change, then we ingest the maximal amount of leucine. So it maximizes our body's ability to develop and to build muscle protein and pretty much all proteins at that rate. So yeah, it sort of flips on the way the slides that I have to show for my guys are is basically it turns on the factory that builds muscle. Leucine is the light switch that does that.
Oh, I like that analogy. I'm gonna steal that from you.
Please.
And yeah, so I mean, so whey protein is gonna have a higher percentage of leucine, which is why we talk about it more so than some of the other proteins. But like you said, like you can use other ones. You just may have to, look at what the different dose is gonna be for that, which is a great point to make. Do you care? So say let's say that a woman comes in and she's like, yeah, I'm doing whey protein every day. I put 5 grams of whey protein in my shake. Like any comment on dosing in terms of single bolus versus maybe she does, I don't know who would ever do this, but like 4 servings of 5 grams throughout the day versus one serving of 20 or 30.
Yeah, I mean the goal is to maximize for if we're talking about leucine threshold, the goal is to maximize the area under the curve to achieve the highest benefit. 5 grams is not going to raise that kind of that there's not going to be a lot of area under the curve, area being like muscle protein synthesis activation. So for the most part, in order to kind of we want to maximize the area under the curve, so we want to dose it the appropriate amount to maximize that area under the curve, especially post-exercise. And personally, we overdose it pre-bed to kind of extend that curve as well. So the lines that I use for our guys is if you want to maximize your body's ability and capacity to build and repair protein, build and repair muscle, build and repair your body, you want to basically have as many feedings. You want to feed protein 3 to 4 hours apart in the amount that's going to maximize that curve. And then you typically we'll have the graph out and then map out, breakfast, lunch, afternoon snack, dinner, pre-bed, 5 boluses, area under the curve, depending on the size of the meal. And you'll get anything from 1 to 2 hours for like a protein shake, as whey isolate versus like a full Thanksgiving dinner will be like 3 to 5, depending on what it's eating.
Mhm. On average, like how many shakes are your guys doing through the course of the day versus meals?
Meals are easier, so we like meals. We like meals for a lot of different reasons. Food matrix, being, first and foremost, carbohydrate first and foremost. But we'll typically, I see guys on the high end 3 a day, and then shakes being like Maybe one or two of those are RTDs, and then perhaps two of those would be blended. One or two of those would be blended shakes. Much bigger fan of blended shakes for a lot of reasons. Um, Vitamin mineral content, fiber, getting some more fruits and veggies in the day, and we're able to control it on our end. It probably tastes a little better as well, fresher, versus like an RTD, ready to drink. A little bit less control, and then might not be the best product slash meal for that specific scenario, because they're a 25-gram protein shake, like a Core Power or Core Life, is going to be that every time. So if you need more carbohydrate for whatever reason, because you just did a ton of exercise and a bunch of cardiovascular activity, some high intensity resistance training or in practice, just protein is not going to be the best solve. You want to pair it with something else. If we blend it, we're able to customize it for whatever the need is specifically, which is a little bit easier. But no, there's no, to kind of take it to an extreme, there's no upper threshold to where I would say, I mean, I would definitely encourage someone to have more food and less shakes. But there's no limit to where it's like, hey, there's 5 shakes. If it's truly a convenience thing and it's like, hey, this is the only way that I'm going to get this kind of protein in with this timing, God bless you. If there's other ways that we can get the micronutrients in, but that is a question I have gotten a decent amount, is like, how many shakes is too many shakes? And it's a bigger question, definitely person specific. But yeah, there's no health specific. At least there shouldn't be, unless there's some sodium risk, or sodium limitation, a potassium limitation. There's something very specific to the individual, to where there'd be like a hard limit on shakes or whey protein.
For the, I think you said Core Power. Is that Fairlife or is that a different one?
Yeah, that's the Fairlife protein shakes. Yeah,
Yeah, I like those ones just
I
for
love
something
them.
to
They're fantastic.
run out the door with.
Yeah.
But I know what you mean. And so when you're talking about, you don't want just protein in certain instances, why is that? What's your goal with adding, I'm guessing carbohydrates, but
Yeah, in an athletic context, fuel. So, I mean, basically the big rocks on our ends are carbohydrate. That is our fuel for almost all of our activity. That is in an athletic setting. We do some beta oxidation. We do burn some fat, but for a fuel source for anything athletic related, that wouldn't be golfing necessarily. We are using primarily carbohydrate in varying degrees, all the way up to 95, 98% carbohydrate for sprinting. I mean, PCR and carbohydrate, versus just fat burning is going to be very low intensity activity, and that changes there. Um, so all that to say this, I mean, we need to fuel carbohydrate to adequately perform throughout the day. That's kind of square one with either high school or collegiate athletes. If we see a performance drop off for their sport, depending on their activity, oftentimes, especially in the collegiate setting, it's they are underfueling carbohydrate for their performance need for training and competition. So from a performance standpoint, that's one of the things we address first is, are they consuming adequate carbohydrate to fuel what their day-to-day living and day-to-day competition? If they are not, then they're going to lose. I mean, we're talking supplementation, but we're going to lose significantly more than the 8% of caffeine, the 5% of creatine, as far as a performance benefit. The way that I kind of illustrate, for the most part, if we're out of carbohydrate completely, is that hitting the wall, that mile 22, 23 of a marathon, where folks like hit the wall as if they just run out of their carbohydrate completely, and then they can't run anymore because that's what primarily the energy source that you use for running. If that answers your question. So carbohydrate, incredibly important. So that outside of protein, carbohydrate is incredibly important for performance. That's typically the gas of the fuel. Protein is more kind of rebuilding the body, the car, not just the engine and everything else, but truly the entire body. Anything that functions in our body is a protein for the most part.
yeah, no, it does answer my question. And just like creatine is riding, a wave right now, I also see protein just being talked about a lot more, which I think is great. And I feel like carbs are kind of getting the shaft right now.
Yeah. Oh yeah.
But I often see it, I don't have your level athletes that I'm seeing on a daily basis, but I have people that are, they're doing competitions, they're exercising, 5, 6 days a week, and they're not properly fueling carbohydrates either. And I feel like that's a piece that we're not talking enough about. I mean, you definitely do, but the general population, I feel like carbs are kind of getting the evil eye.
No doubt. I think a lot of people dip their toes into something that would be closer to like trying to get to ketosis. Like, hey, I'm going really high protein and even some high fat. I'm gonna go veggies and then like a little bit of fruit. And so they're just underfueling, not dangerously so. They're gonna feel like crap, and then they, don't perform well depending on what they're doing and the amount of activity that they're doing. Absolutely. I mean, I've got coaches that, again, dipping toes into something that would be close to ketosis, but unless you go all the way there, you're just going to feel like crap in this gray area between kind of normal metabolism, adequately fueling your body for performance versus going, full keto adapting and then exploring that to see if that would be a fit for your lifestyle and for the activity that you're doing, which for the most part it's not for most people. Um, but yeah, it's interesting. It's like a weird like pseudo starvation that people think like this is what dieting feels like. I'm
Mm-hmm.
supposed to be hungry. I'm supposed to have low energy, and it's like not at all. You're able to increase lean mass. You are able, depending on your training level, to also lose fat mass and feel great. And it's like you can do those things. Maybe not both at the same time, depending on the training status. But it doesn't have to feel like true crap, like dieting, and then binge eating to make up for all the carbohydrate that you didn't consume during the week, eating, salads and nothing but chicken.
For sure, for sure. And I've seen it where, especially in the running population, um, an example is like a guy who his testosterone comes back at like 350, maybe he's like 40 years old, which is not a great testosterone level for that age. And it almost looks like an overtraining picture, but you talk about their training load, and you're like, that's not that much. Like you should be able to do that. And it comes to underfueling, which is just as important. And the symptoms are really similar. So like lack of sleep, low testosterone, inability to recover, GI distress is really common in those people, bloating kind of things. But I'm glad that you said that because I think that we need to talk more about it for not just athletes, but like if you are an active person who is exercising regularly.
100%. And especially with like someone who's incredibly like either type A or really extreme about their hobbies where their output is incredibly high and they don't take the time and most people don't, and why should they? That's sort of our job, but to map out exactly what do I need to sustain this performance, and then the am I increasing or decreasing kind of comes after that fact. But that's sort of the order of operations that is really important, where it's like caloric need, which changes drastically depending on the day and activity, and then carbohydrate and protein, basically A and B, and then fat left over. But if you cut out fat completely, which is difficult to do and definitely not in vogue right now, but that can really impact testosterone production and things like that as well. So going extreme in really any area without also mapping it out to what's needed is gonna create injury risk, decreased performance, fatigue, all those things. Yeah.
Yeah, great point. Um, Okay, we talked about what I consider like the main players. In my mind, we're going on to like level two or whatever
100%.
we want to say. Would you
Yeah.
agree with that? Where the next people we're going
Absolutely.
to talk about like are in a different class, kind of?
I would. To me, there is a top five, but there's absolutely, yeah, the king, queen, caffeine, creatine are by far and away the most well researched and like broadly reaching for what they do. Absolutely. So yeah,
Okay.
I agree.
All right, we're moving on to beta alanine. And first, what is beta alanine? Kind of how does it work in the body? Why do we care about it?
Yeah, absolutely. So beta alanine, ingestion of beta alanine increases like intracellular carnosine, which shuttles protons. So it allows you to prevent the acidification of intracellular space, which can be and is one of the many things that can cause fatigue. So the goal is to basically buffer yourself intracellularly. I say like that the way that I describe it for my guys, and I don't I mean, we have it because it's kind of fun to have, and there's a really visceral effect of like the tingling if someone's ever felt that for beta-alanine, but it's really the burning sensation in the muscle after extended, really high intensity activity. So like sprinting for an extended period of time or doing like repeats on an assault bike at max effort, and you feel this like muscle burning. That's kind of what I associate with, hey, it will stave off that muscle burning feeling a little bit. So much smaller benefit, but that's to me that's helped a little bit for kind of communicating as to like when that would be beneficial. And that's kind of as a whole a pretty rare state to get to. Depending on the training, some people might be hitting that often, which is incredible. But yeah, that's for the most part for in our population, it's like defensive backs or wide receivers that are doing like long routes very continuously or really high intensity training. That's when it's beneficial. Now, it can't hurt outside of the paresthesia effect. And some people really like it. I'm a fan of it. Kind of feels like, hey, so it's working now. But yeah, as far as like a true performance benefit, not super high. Yeah.
Do you know what the performance benefit may be? Do you have any stats on that?
Yeah, it's like 1 to 2, 1 to 3%, depending on the output there. Kind of similar to bicarbs, even less than that, but yeah, very specific. So situations where I would recommend it would be like someone who's in like a 400-meter relay or 200, 400 hurdle or something where it's like, okay, I'm guaranteeing that I'm going to hit this threshold consistently. Yeah.
Yeah. Beta alanine for, the people that I see, I've recommended it a handful of times just because most of my patients are not at the level where 1 to 2% increase in performance is going to, they're just not going to notice it at all. Do you take it personally?
Not regularly, to be
Yeah.
honest. Yeah, not regularly.
Let's talk about dosing if somebody does want to experiment with it. What does that look like?
Yeah, so we dose 3 grams of beta alanine at a time, and depends on the individual. Some folks like it's kind of been like a Pavlovian effect where they want to feel that paresthesia, especially games. So we like we'll bring it out on the sideline, and if a guy wants like a double dose to feel like he's feeling something extra, then we'll use it like that. But per dose, that's what we use.
Yeah. I can see that being, like you said, it's almost like a placebo effect too, where they just need somebody to cheer them on in their own body.
100%. And
Right.
placebo effect is still in effect. So we
Yeah.
absolutely we use all the tools at our disposal for sure.
Love it. All right. Any myths, any fun facts about beta alanine?
Um, yeah, I mean, you mentioned exactly, but we're talking like these small percentages, and it's a very popular supplement ingredient along with niacin because it's like a really visceral response. There shouldn't be any really negative side effect, but I would just again to say, like we mentioned earlier, of just like it is such a very specific use case to me of when it would really be beneficial and how beneficial it would be to where I would not break the bank on beta alanine supplementation. But if you're building a pre-workout or purchasing one and it has it, not the worst thing in the world if you enjoy the effects. But yeah, not a stop the car and go out and buy it kind of a supplement.
Yeah, agreed, agreed. Okay, let's talk about nitric oxide boosters. Why do we care about not nitric oxide in the first place?
Yeah, first and foremost, to basically increase vasodilation. And then there's some really good research saying it improves firing capacity for type 2 kind of explosive muscle fibers. But those really, that vasodilation is kind of the biggest one. And there is an additive effect. It's sort of like creatine light to where if you are taking it consistently, the levels in your body will actually slowly increase. We were trying to this was a long time ago, actually. We were trying to test different nitric oxide supplements, and we were testing them daily. So we tried a different one every day, and we're like, "Wow, this one's better than the one the day before. This one's even better than those two." And they were like, "Wait a minute, it's yeah." We called a researcher at UT at IBM, and he was like, "Yeah, yeah, it's building in your system. You're like semi-loading it." I put it on a kind of a more of like a week load, like kind of like a half creatine time frame of kind of loading in your system. So there is somewhat of a loading effect, and we use it a little bit for some of our guys that have skeletal like fractures that would be in spaces that don't get a lot of great circulation. So your feet, your hands, certain joint spaces as well. For us, it's kind of like a can't hurt, might help. As far as like true trials of like, hey, that increases healing to some degree that doesn't exist, but it's more of like a net mechanistic stretch of like, hey, the blood flow is not great to the feet or to the capsular space in the knee. Like if we're improving blood flow for the body, maybe we can funnel a little bit more, white blood cells to the area and clean it up a little bit faster.
Which one are you guys using?
We use the Beat It Sport. So we use it, it's out of the UK. It's a nice little 2-ounce shot, which is amazing. I've been blending and mixing beet powder almost my entire career, and God does it stain, and it's a pain in the ass to use. So the less blending I can do with supplementation, the better, I think. So yeah, it's Informed Sport certified. We get it out of the UK, and there's nice convenient shots that are shelf stable that we can keep in the fridge. Guys can grab them, shake them, and then enjoy the effects of vasodilation.
Cool. And then we have sodium bicarbonate. What's the thought process around that?
Yeah, so sodium bicarbonate is a like beta-alanine is an intracellular, increasing that muscle carnosine or the cellular carnosine. Sodium bicarbonate is a very weak extracellular buffer. So those are the top five, sodium bicarbonate being the last one, and really a really small benefit. But if it gives someone an extra second, an extra half second at a higher RPM, or a higher output, then it will have been worth it for someone in like an extreme like the ones we talked about for beta alanine. But the dosage, it's a little bit more involved. Chronically loading is considered better because you're taking a heroic amount of sodium to get to the levels that are recommended. I use the 200-pound person, and that's we're talking 20 plus grams of sodium bicarbonate, which is baking soda. So if you can only imagine what 20 grams at once will do to your GI tract. So we definitely try to chronically load that and sprinkle it in, 3, if not 4 times a day, to kind of slowly chronically load. And we're talking about increasing the pH of that extracellular space there. But if we can stave off a little bit of that acidification of that extracellular space in the muscle to reduce fatigue, for some very specific folks, not the worst idea in the world. We use it in trying to have a more sneaky way to supplement more sodium for our football players. Incredible heat at Stanford, and they really trust me, and it tastes god awful, as you can imagine. But I would not even venture to bring it to the pros because they would throw it in my face probably. It tastes that bad, and I told the guy, I'd be like, hey, this is gonna taste like straight salt water, like the saltiest thing you've ever had. And the guys at Stanford were great. They were just like, yeah, let's do it, like shooting it back. But yeah.
This last one is not I wouldn't consider it an ergogenic aid, but we talked about it briefly on the first podcast, tart cherry juice in terms of delayed onset muscle soreness.
Yeah, absolutely. Indirect ergogenic aid, reducing those effects of that delayed onset muscle soreness and improving, basically being a natural source of melatonin, helping sleep onset a little bit and sleep quality. Again, it's to me, it's in the category that's kind of a step below. It's kind of in that anti-inflammatory indirect. So like the curcumin turmeric, which again has totally other effects as well as the anti-inflammatory. But then that tart Montmorency cherry has been studied. And there's some other cool research with more of those kind of more obscure antioxidants, anthocyanins, and things like that. But it is one that is very popular, I think, in the sports space. Chair Buddy's done a fantastic job of kind of getting into most spaces by creating a product that is in its own category of like this sleep aid, and most dietitians love it, not necessarily for the tart cherry effects, which is great, and that's an added bonus, but the antioxidants and really the carbohydrate, to be honest, is a nice added effect as well. So we're able, it gives us kind of, they've armed us pretty well with tools to explain, hey, this is what this is for. And then we are sneakily giving them, 20 or 30, depending on the volume and the type of juice, um, grams of carbohydrate, say post-workout or even before bed to kind of sprinkle in and add a little bit more to that individual. So they do a very low carb version as well, but it's definitely a tool in the toolkit and kind of has its own space category.
Mm.
Um, yeah, and that kind of antioxidant effect. They've done a good job.
Yeah, interesting. This actually should have been up top, but for organization purposes, it got boosted to the bottom. Hydration and performance. You mentioned this on the first podcast, and I'm like, I'm making him say this again because my jaw dropped. I was like, what? And obviously I know hydration is important, but the stat, do you remember the stat? It's incredible.
Yeah. Yeah, I mean, if we're more than 1 to 2% dehydrated from our euhydrated state, like we're losing 15 to 30% of our performance right off the bat. And like we talked about creatine, we've talked about caffeine, and these are the best things that are out there. And they are, 1 to 8% and 3 to 5% of a benefit for select cases. And if you are just dehydrated, you are throwing out 15%, 30% of your performance out the window. And that could be dehydrated going into it. That could be dehydration that is a result of training, but not rehydrating during training. So yeah, I mean big rocks, when we're talking about big rocks and talking about carbohydrate fueling, like hydration is right up there. Sleep is right up there. Like the effects of not getting those right are so much bigger of a magnitude, 4 or 5-fold percentage wise, than any supplement, even the absolute best ones dosed totally appropriately. It's pretty wild. And I try to do my best. They're not as like it's not as sexy to sell carbohydrate, periodization and fueling and being hydrated, and they've heard it 1,000 times, and proper sleep. But just the effects are so great. Like we've got to get super creative to continuously reiterate that if it's not being done appropriately, to try to get it done appropriately for that individual.
We need to like create like proprietary blends of like sleep and carbs and hydration so people want
Yeah.
to buy them.
Yeah, that would be, yeah, 100%. What is the, I forget what it's called now. I'm trying to, I might be thinking of something else, but I mean, the chemical name for water, like the dihydrogen oxide or something, and just creating some supplement
That's
that is just,
smart.
yeah.
That's smart. That's a really good one. Yeah, absolutely. I know. It's fascinating. I mean, because I see it every day. People come in and they're like, okay, what supplements should I be on? Or, what tests should I do? And I look at their paperwork and I'm like, well, you're sleeping 5 hours a night. You're drinking, 8 drinks, alcoholic drinks a week, and you're not exercising. Like, we can talk about supplements, but you're talking about tiny, tiny, tiny changes versus you're missing this huge foundation.
100%. It's like if
Preaching to the
someone
choir.
walks into the office with like a nail in their head and complaining of a headache, it's like it's gonna be really hard. We can dance around this other stuff, but at the end of the day, like you might want to get the nail out of your head.
Totally, totally.
Yeah. Yeah. And that's part of the art to what we do as well, is like being able to decipher where this individual is at. Do they need a small win in a specific
Yeah.
category and answer the question before they're willing to approach something that does change their lifestyle significantly? Um, and we pick our battles, and you definitely that's as like that's part of the art to it.
Mhm.
But yeah, it's hard to like, not be like, if you just fix this, I think we'd be in great shape or much better shape than any supplement. But
Yeah, yeah. Okay, let's talk about third-party testing and just supplement like certifications. There's going to be some labels that you can be looking for, but when you're looking for your athletes, what are kind of the things that you're scanning for?
yeah, pretty specific things. I mean, there's definitely there's a stepwise process of, okay, is it a reputable company that's been around a decent amount of time? What does the actual supplement versus nutrition facts panel look like? And then, is it the FDA for the most part does not regulate supplement facts panels at all. They try to, but they don't. I mean, it's a smaller office. I'm sure it's a smaller office now. Small office that that tries to regulate it and essentially doesn't. So any average person can toss together a couple powders in their garage, slap a label on it, and sell it to GNC, and it will be there. There's nothing that's really monitoring the quality of what's in that tub as well as what is actually in that tub. I think they did a study in what was it, 2014, and found that 25% of the supplements were adulterated or
Mhm.
contaminated in some degree. And that's not even, it could also not even be, negligent or nefarious on the manufacturer's part, depending on where they're getting their ingredients from. They could be, herbals are notorious for heavy metal poisoning, heavy metal contaminants if they're coming from Asia. There's just a laundry list of kind of issues where if the two labels that we look for are either informed choice, informed sport, or NSF certified for sport. Those are kind of the two for a sports dietitian. Do you feel good about recommending a supplement? Those are the two things we look for, informed sport or NSF certified for sport. Basically certifying that what is in the tub is on the label and vice versa. And without that certification on our end, we would be putting ourselves at professional risk by recommending a supplement where if we recommended something, an athlete tested positive for a banned substance, they point to this that we recommended that's not third party tested, we would be potentially held liable for that. So it's a way for us to CYA as well for us to kind of ensure that at least the supplement facts panel relates to what is in the product. And again, there's a lot of conversations that I've had with suppliers, and I understand kind of these are not cheap things to do. These are pretty expensive because they're batch testing, they're testing for banned substances. In order to get this label, it is not a cheap undertaking for a lot of especially smaller producers of this. To where it's a huge commitment. But if they're really looking to get into the professional or collegiate athlete space, to me, it's part of the barrier of entry, so to speak. And informed sport is a lot more popular overseas. NSF is a lot more popular here. NSF's a little bit more expensive. They used to actually use informed sports labs, but anyways, beside the point. Something to mention as well. Yeah, something to mention as well is that these are not guarantees of quality. These are not guarantees that the dosage is correct, that the recommendation on the bottle is correct. What I tell my athletes is all these are doing is certifying that that what is on the label is inside the bottle.
Which is big because if you look at some of the research in terms of they've done studies about pulling things off the shelf and what's actually in it. I just posted one thing a few weeks ago where there's a company that is selling a supplement called Vitality that has Cialis and another similar medication. Prescription medications were found in the supplements. So it's like it's crazy. And of course, that one probably sold pretty well because you're going to get an actual effect, but super dangerous for a lot of people that should not be taking a prescription medication, especially when they don't know it. There was just something yesterday that came out, like you said, it was an herbal compound, and there were high levels of both lead and mercury detected. So they put an FDA recall on them. So definitely things to look at. NSF Sport is something that I recommend for not just athletes, but just in general, because it's another screening tool in terms of, okay, at least you know this much about it. And there's some other ones too, but I think NSF Sport, it's just, I'm actually not even as familiar with the other one that you mentioned because I feel like the US is so much more NSF Sport centered.
Yeah, and MLB is an example of like due to the MLBPA, they are only allowed to supplement with NSF certified for sport products. So the NFL has a little bit more leeway, and other professionals organizations a little bit more leeway, but that just kind of shows the extreme. I'm sure they got paid a lot for that, but the kind of the extreme nature and it truly is in our world the barrier to entry for taking a supplement. And it's a really easy no if it's not third party tested, because it's like, hey, this sounds great, it looks great, but we don't know that that's what's actually in there. And you mentioned it, but yeah, these companies can put in prescription drugs, can put in banned substances, and they're banned for mostly for health risks, but they're also banned sometimes because they give you a huge added benefit to whatever you're doing, a huge stimulant benefit or an HGH growth hormone benefit, which yeah, is super risky. It comes with its own health risks times 100, but you want to know what you're taking, and you want to be safe with what you're taking 100%.
Yeah, agreed. If Olympic athletes as well will only use the NSF sport because of the, what would it be? WADA, USADA, I guess it's both of
Yeah.
them.
Mhm.
But making sure that none of those ingredients are going to be there because it's much stricter too.
You'd hope so. God, I'd hope so. If you got one shot every 4 years,
Right.
God, I would hope so that they're using. There was an example of a US swimmer. It must have been either 2 or 3 Olympics ago now that was taking it was one of the pyramid scheme supplements, and it wasn't third party tested at the time, and they were taking a multivitamin, and it's like, oh, I've been taking this multivitamin for 2 years or for a year and for months, and I haven't tested positive. And the product finally, like the levels in her body finally got high enough of this banned substance to where she did test positive, even after, oh, I've been tested taking it, but only after X amount of months or years did it finally pop positive on a drug test, and then she ended up missing the Olympics because of it. So yeah, it's a risky. It's always going to be a risk. And God, there's 100 times more sketchy supplement companies out there than there is ones that really take care of you or try to take care of you. And I think, I don't think they mean anything, hopefully nefarious by it. But there's just a lot of questions that got to get answered especially if you're putting, playing eligibility at risk or your health at risk at the end of the day. And it's not like these things are triple the price or twice the price of a normal non-third party tested supplement. So, something that I have noticed, that you do want to keep in mind is go through the website and actually double check that the product is third party tested on either NSF or Informed Sport website, because some companies I've noticed have started putting the label on the product without actually going through the process. So that's incredible.
That's like a different level of a lack of integrity for me. It's like you're not only not willing to do like because it is expensive, right? Like not all companies are
Yeah.
going to do it because of financial reasons, but to then lie about it is crazy.
So yeah, real bad. Yeah, that was an easy email and easy call to Inform Sport, let them know like, hey, this company is not on your website. Flagged for a number of reasons, but I was like, let me just double check. And they batch NSF batch or does tests all of them. Inform Sport batch tests them. So you do still look at the lot number and go back and double check that lot was tested for sure. But yeah, it's yeah, you want to be careful about this stuff. A lot of
Yeah,
bad actors.
a lot of bad actors. And we're at the end of the podcast. We're talking about some of the best ones on the market in terms of supplements. Like you said, maximum of 7% improvement in performance. If you're getting more than that, it's probably because there's a prescription medication that should not be in there in it.
Yeah.
And so to sacrifice something for, that little of an effect when you don't know what's actually in it, like not worth it.
100%. And something that I joke with my guys about as well is there's hundreds of supplements that are like, hey, will improve testosterone, will improve vitality, and it's like some random herbal, and it's like, look, like if it did to the point where it would be beneficial, you would test positive. So if you're gonna take testosterone, at least get a prescription, take test. If that's, don't do that. I'm banned. I'm not recommending that. But like, if you're trying to increase your testosterone to the point where it is a performance edge, I wouldn't go about it by taking some sketchy on third-party tested supplement and like dancing your way around it. Like, if you're taking the risk, take the risk. If you don't take the risk, I wouldn't recommend it, but don't take the risk. Yeah.
Yeah. No, and I can speak for firsthand because people always want to boost their testosterone and they say, can we do it naturally? And I tell them, I've never ever seen one of these supplements work. Like literally never once in my entire career have seen them work. And I've experimented with people. I'm like, okay, we can do the tongue cat Ali, like, because I get it. I've read that
Perfect.
paper. And every single time we run a baseline and then we run a follow-up, and I've never seen clinically significant changes in testosterone. So much to, I like give people this exact lecture before they want to try it. And I'm like, would not waste your time, wouldn't waste your money. If you really need to do this, all right, let's go. But we're going to measure it because I want you to see. And yes, you can get little changes, but you're going to get little changes in testosterone on a regular, normal basis. But anything clinically significant, especially when you're comparing it to actual TRT, it's not even
close.
not even close.
Yeah. Or improving sleep or lifting heavier or, like you want to do it naturally? Like, let's talk about naturally. Let's talk
Yeah,
about the alcohol
right.
that you're consuming, things like that. So,
Yeah,
hey.
yeah. Awesome. Anything that we didn't talk about that you want to add?
Hmm. I would just say that I mean, as far as direct ergogenic aids, we touched on the top two, we touched on the next three down the list. Those are the top five for a reason. Those are the top five that have this research. If anything is saying that it has a greater effect, ergogenic effect than that, we would love to see it if it's something brand new. But likely that they are selling something that doesn't exist. I mean, we are actively, finding every possible edge for for a population that's looking for it. So if there's something that was safe that we would be trying to find, like we would please send it our way. But your flag should go up. Your spidey senses should be tingling if you see anything that is promising to add 5 pounds of lean mass in a week or, improve performance by 25% overnight or anything like that.
That's a great, great point. 100% DM me. Like we'll go through it. It'd be a great new podcast. But such a good point. Like these are the things that that have been the most researched. They're still not super impressive, but they're decent. So yeah, you always hear people saying like, this is the new thing. This is, and like it lasts for a week. And then we're like, oh gosh, that was terrible. Thank you so much for coming on. Where can people find you to learn more about what you're doing?
Yeah, I would say if they're a medical professional, nutrition professional, you can look at Summit Nutrition Network is kind of the professional network that we've created, right, going on 3 years now. For folks that are interested in that, there's a lot of great resources. It is more sports dietitian focused, but we've got performance chefs and other folks on there as well if you're looking for a kind of a high level networking and then resources in that space. But yeah, for personal stuff, my Instagram is a great way to kind of get in touch, DMs and things like that.
Awesome. And we'll put those in the show notes. Thank you again for coming on. This is wonderful. And thanks for being my first repeat guest.
Great. I know. I got to frame that. That's awesome. No, thank you so much for having me on. It's always a blast. Yeah, I'm excited for the next time we go through a different category. It'll be great.
Love it.